Hello, my name is Lisa Rosca, and today I will present strategies for providing disaster mental health support following a tragic active shooter incident at a local high school. I'll address the key strategies from disaster mental health frameworks, evidence-based approaches, and personal experiences, along with a Christian worldview. In responding to survivors of a school shooting, the immediate priority is to ensure safety, stabilization, and connection. This is most effectively done by following the SOTA principle of stop, consider options, decide, and then act, as outlined by Jacobs. One must employ the steps of psychological first aid also as the SOTA principle is being integrated. Core strategies from disaster mental health models, such as the psychological first aid, emphasize offering calm presence, meeting basic needs, active listening, providing accurate information. Survivors benefit from counselors who promote a sense of agency by allowing small choices and facilitating peer and family support. These strategies will help equip to reduce acute distress and lay the groundwork for recovery. So for review, the psychological first aid core actions, which were integrated in the SOTA steps, are contact and engagement, safety and comfort, stabilization, information gathering and prioritizing of assistance, then the practical assistance, connection with social supports, information on coping, and linkage with the collaborative services. The initial response is, as I stated before, following the SOTA principles and implementing safety, stabilization, and contact. There's many evidence-informed strategies to be implemented. The current scholarship emphasizes that disaster mental health care should be trauma-informed, developmentally sensitive, and evidence-based. O'Toole talks about there is a step-by-step approach care for trauma support, offers broad supportive services for the survivors while specifically looking at those who have been most significantly affected by the trauma and have persistent symptoms. This is complemented with Jay Cox, who talks about the stepped care and the school-based cognitive behavioral therapies that have been proven to be effective for those struggling with PTSD, especially those among adolescents exposed to mass violence. Another evidence-based approach involves promoting resilience through community and connectedness. Sokol talks about group-based interventions in schools that can minimize the isolation, normalize reactions, create shared meaning after a mass shooting. Additionally, Stebecki and Jacobs address the stress-reducing activities, integrating mindfulness and grounding exercises into crisis response that can lower physiological hyperarousal in youth and also help prevent anxiety. Observed specific techniques. From a Christian perspective, we can consider the further evaluation of implementing a biblical worldview into the practice, but for some specific techniques, looking at grounding and breathing techniques, helping them to do box breathing, calm their physiological arousal. For youth, journaling or art expression can be a subtle and wonderful way for them to express their emotions. Consider information sharing as far as giving them detailed information within a scope that is safe to provide any misinformation and also help them reduce their anxiety. The faith-based and spiritual component we'll talk about a little bit further, just as far as implementing opportunities for them to be involved with chaplaincy referrals, prayer circles, and then just honestly normalizing and giving them hope and reassurance. Finally, the Christian worldview integration, Jesus as the comforter. We look to God as the good shepherd who provides comfort in the darkest times. Scripture reminds us that God is present even in tragedy. The Lord is close to the brokenhearted and saves those who are crushed in spirit. The emphasis of creating hope, comfort, and healing in Jesus Christ, considering their receptivity to scripture reading and prayer, engaging with active referrals to pastoral care or spiritual referrals. Finally, in conclusion, providing disaster mental health care in the wake of an active shooting incident requires combining the immediate stabilization for long-term evidence-based strategies by using psychological first aid, the SOTA principle, trauma-informed approaches, and interventions such as trauma-informed cognitive behavioral therapy, mindfulness, or group support. The survivors are given tools to recover. These interventions, combined with the Christian worldview, can allow counselors to extend not only psychological support, but also spiritual comfort rooted in Scripture and God's promises of healing. Thank you for your time. If you have any other questions, I'd be delighted to answer them and look forward to your discussion post replies.